A patient on VA ECMO for cardiogenic shock has developed severe fluid overload and AKI. Which of the following is an indication to prioritize hemofiltration over intermittent hemodialysis? A. The patient has a high heart rate. B. The patient is on high-dose vasopressors and cannot tolerate rapid fluid shifts. C. The patient has a high white blood cell count. D. The patient is awake and talking. Answer: B. The patient is on high-dose vasopressors and cannot tolerate rapid fluid shifts. Explanation: CRRT, hemofiltration, is indicated for patients who are hemodynamically unstable. Intermittent dialysis can cause rapid changes in preload and osmolality, which may destabilize a patient already requiring ECMO support. Which metabolite, when elevated, is an indication for CRRT to prevent dialysis disequilibrium syndrome during the initiation of therapy on ECMO? A. Lactic acid. B. Serum urea, BUN, greater than 100 mg per deciliter. C. Magnesium. D. Bilirubin. Answer: B. Serum urea, BUN, greater than 100 mg per deciliter. Explanation: while a high BUN is an indication for starting CRRT, it must be done cautiously. In ECMO patients with extremely high urea, continuous hemofiltration is preferred over intermittent methods to prevent cerebral edema caused by rapid urea clearance. In the setting of VV-ECMO for ARDS, ultrafiltration is specifically indicated to manage right heart failure by doing what? A. Increasing the mean airway pressure. B. Decreasing pulmonary vascular resistance, PVR, through fluid removal. C. Increasing the blood's oxygen carrying capacity. D. Providing a source of exogenous calcium. Answer: B. Decreasing pulmonary vascular resistance, PVR, through fluid removal. Explanation: fluid overload increases pulmonary congestion and PVR, which strains the right ventricle, RV. Hemofiltration is indicated to reduce RV preload and afterload, by reducing lung water, which is vital for VV-ECMO success. What is the indication for using pre-dilution replacement fluid during hemofiltration on an ECMO circuit? A. To increase the concentration of electrolytes. B. To reduce the risk of filter clotting by lowering the filtration fraction. C. To increase the amount of CO2 removed. D. To cool the patient down faster. Answer: B. To reduce the risk of filter clotting by lowering the filtration fraction. Explanation: when CRRT is spliced into an ECMO circuit, clotting is a major risk. Using pre-dilution, adding fluid before the filter, lowers the hematocrit within the filter, reducing the risk of thrombosis and extending filter life. A patient on ECMO for an aspirin, salicylate, overdose requires hemofiltration. What is the specific indication for this? A. To treat the resulting respiratory alkalosis. B. To enhance the clearance of the drug and correct the metabolic acidosis. C. To increase the patient's blood pressure. D. To prevent the aspirin from sticking to the oxygenator. Answer: B. To enhance the clearance of the drug and correct the metabolic acidosis. Explanation: extracorporeal toxin removal is a classic indication. Aspirin is a small, water-soluble molecule that is easily cleared by hemofiltration, which also helps correct the profound primary metabolic acidosis seen in toxicity. Which pressure alarm on a CRRT machine would indicate that the ECMO flow is potentially starving the CRRT intake? A. High venous pressure. B. Low, negative, arterial/access pressure. C. High effluent pressure. D. Low TMP, transmembrane pressure. Answer: B. Low, negative, arterial/access pressure. Explanation: if the CRRT machine is pulling from the ECMO circuit and the pressures aren't balanced, a highly negative access pressure alarm is an indication to either reduce CRRT flow or change the connection site. Why is hyperammonemia in a patient with acute liver failure on ECMO an indication for high-dose hemofiltration? A. Ammonia is a large molecule and needs high pressure. B. To prevent hepatic encephalopathy and cerebral edema. C. Ammonia causes the ECMO pump to fail. D. To improve the patient's skin color. Answer: B. To prevent hepatic encephalopathy and cerebral edema. Explanation: ammonia is neurotoxic. In patients with ECMO liver, congestive hepatopathy, CRRT is indicated to clear ammonia when the liver cannot, protecting the brain from swelling. What is the indication for bicarbonate buffered replacement fluid in a patient on ECMO with severe lactic acidosis? A. To keep the blood from clotting. B. To neutralize the acid load while the underlying cause of shock is addressed. C. To prevent the oxygenator from becoming acidic. D. To increase the patient's sedation level. Answer: B. To neutralize the acid load while the underlying cause of shock is addressed. Explanation: ECMO stabilizes the heart/lungs, but metabolic cleaning requires CRRT. Bicarbonate-based fluids are indicated to directly correct the pH while the ECMO provides the necessary perfusion to clear the underlying lactate. In a patient on VA-ECMO, hemofiltration may be indicated to manage the side effects of which medication commonly used for sedation? A. Propofol, propofol infusion syndrome/PRE. B. Midazolam. C. Fentanyl. D. Vacronium. Answer: A. Propofol, propofol infusion syndrome/PRE. Explanation: PRE can cause refractory metabolic acidosis, hyperkalemia, and rhabdomyolysis. Hemofiltration is indicated in this emergency to clear the metabolic byproducts and manage the electrolytes. When considering the weaning phase of ECMO, what is an indication that the patient still requires CRRT? A. The patient is making 2 milliliters per kilogram per hour of urine. B. The patient cannot maintain an acceptable pH or fluid balance without the machine. C. The patient's heart rate is 80 bpm. D. The patient is able to follow commands. Answer: B. The patient cannot maintain an acceptable pH or fluid balance without the machine. Explanation: the renal wean and the ECMO wean are separate. Even if a patient is ready to come off ECMO, persistent AKI or fluid overload is a clear indication to transition the patient to a standard, non-ECMO, CRRT or dialysis circuit.